Okay. Hi, class. My name is Brianna Vasquez, and for my critical assignment presentation, I decided to do it on the effects of both low-fat diet and a low-carbohydrate diet. What are their effects on body fat percentage? Okay. So for the introduction, just a little background information on the diets. A low-fat diet does consist of reducing the amount of fat intake. So this could be getting a reduced fat dairy product. That would be an example of following this diet. And then for a carbohydrate diet, this does involve choosing foods that are considered low carb, and this could be like fruits or vegetables. And let's see, diets have been shown in the past to have help with weight loss and the loss of body fat. And these certain diets, such as the low carb and low fat, these diets have been shown to have showed these results in individuals. So we'll see how this affects body fat percentage. And so the reason why I chose this subjects were because obesity and cardiovascular diseases have become such a big issue now in the U.S. now more than ever. Body fat percentage is a way that we can help predict these diseases and essentially help stop them from occurring. So also knowing the diets that can help reduce the chances of having these diseases and having the reduced body fat percentage the body can have. So the reason why I chose this to look more into this subject was because there was little to no research on how exactly a low versus a low fat diet does affect body fat percentage. So expanding this research could help individuals in the future decide if they want to take part in these diets to help lower their body fat percentage. Okay. So for the problem statement, my research question was, what is the effect of a low-fat diet versus a low-carb diet on body fat percentage? And so my hypothesis was a low carbohydrate diet will contribute to a greater decrease in body fat percentage rather than a low fat. So we will explain that later in the presentation. So for the methods section, my participants did consist of 20 individuals. These individuals were male and female, 10 male, 10 females. Their ages were between 30 to 50 years old. And these individuals were chosen by a simple random sampling. Their names were pulled from a list obtained by the local health department. And the health status was also taken part of. It was done by a survey because knowing there are any pre-existing health conditions could affect the study. That is why we took part of it. And then for the procedures, the participants were randomly assigned to each group. So one of the group was a low-fat group, and the other group focused on the low-carbohydrate diet. And so these participants were also instructed to have no change in their physical activity. They will keep on doing what they were doing before the study. And they were also instructed to follow these specific diets assigned for 3 months. And so how were their body fat percentage measured? It was done using the DEXA scan. This scan is like an x-ray. It takes measurements of body fat, their body fat and muscle tissue and bone tissue, I believe. And this was done at baseline and at the end of 3 months of the study. So for methods continue, the statistical test, there was a pre and post results that were used for a gain score analysis, and the gain score analysis was used to compare both the effects of the low fat diet and the low carbohydrate diet on body fat percentage. The alpha was set at 0.5, and this means that the differences would be considered statistically significant if the p-value was less than 0.5. Okay. Now, for the results of the study, the low carbohydrate group did have an average height of 167.4 centimeters with a standard deviation of 11.3, and the average weight for that group was 78 kilograms with a standard deviation of 10.6. And for the low fat group, they had an average height of 172.1 centimeters with a standard deviation of 9.9, and their average weight was 73.5 kilograms with a standard deviation of 12.6. Now, again, a gain score analysis was used for the study, and it was used to compare the differences in body fat percentage over the 3 months. And then after that, after the gain score analysis was performed, it was found that there was a decrease in body fat percentage within both groups, but the low carbohydrate group did have a greater loss of body fat, and their mean was at a negative 0.602, while the low fat group had a mean of negative 1.302, and their t-stat was at 1.4 with a p-value less than 0.001. So for the discussion, so the reason for this study was to present the effects of both a low fat diet and a low carbohydrate diet, and what are their effects on the body fat percentage. And after doing this study, the results did show that both of the groups again did experience a reduction in body fat percentage, but the low carbohydrate group did experience a higher loss of body fat. And this study is again important. Is an important issue right now because again, obesity and are just an important issue right now with individuals, and knowing the differences how these diets work and on their effect on body fat percentage could help an individual reduce the chances of getting a serious health issue and could help an individual have a healthier and longer life. So, and that is it for my presentation. Thank you for watching.